It's my pleasure to introduce our first speaker of today, Julie Bush. Julie received her Bachelor of Arts degree from the University of South Florida in Social and Behavioral Sciences. She received her associate degree in nursing from Valencia Community College, and she has 5 years' experience as a neonatal nurse. She is currently the pediatric transport coordinator for the pediatric and neonatal transport team at Florida Hospital in Orlando. So you're probably thinking, well, what does she know about this? Partners in Care. Hopefully as a nurse she knows something, but Julie is the parent of 2 high-risk children. She has spent 9 years in peer counseling of parents of premature infants and high-risk children, both in and out of the hospital setting. And she was instrumental in the restructure and development of NeoCare, which is a resource network for families of premature and high-risk children in the greater Orlando area. She has served on that in that organization for 7 years and continues to serve on the executive board. So she's held several offices within the NeoCare organization. She is also on the board of directors for Parent Care National and is the Florida State Liaison for Parent Care. She gives us a unique perspective of combining her experiences as a parent with her experiences as a neonatal nurse. Please help me in welcoming her. Are you going to stay? Okay, good.
Good morning. I appreciate the opportunity to be in Atlanta this morning. I told Margaret earlier it's been several years since I've watched the colors of the trees change. I told my children I was going to see it. They looked at me like I was insane. They said, "Trees' leaves are green." I said, okay. I also got to fulfill a lifelong dream of every Orlando resident, and that is to drive in rush hour like a tourist in someone else's city. And I did that very well last night. The car will never be the same again. I am, at different times throughout my day, a nurse, a support group person, and a parent. And sometimes these things combine nicely. Sometimes they don't. Sometimes one thing is more important than another at any given moment. What I'd like to do this morning is share with you a few perspectives that I have come across in my lifetime and some that have been shared with me by other parents and other professionals. Even though I am a nurse now, I was not 9 years ago when my first child was born. I was a parole officer for the Department of Corrections in the state of Florida. My husband was a teacher. We were 24 years old, and we had our life very well planned. You know how it is when you first get married and you've got A follows B follows C, and heaven forbid anything should interrupt that. We were going to have a girl. Her name was going to be Kimberly Lynn. She was going to have blonde hair and blue eyes, and we were going to go home and live happily ever after. I should have known when Bradley Sean was born that we were in trouble with the rest of our predictions. He was born at 36 and a half weeks and a little over 7 pounds. Unfortunately, he was also born with very large white patches where his lungs should have been, although we didn't know that at the time. Do you ever have one of those memories that when you sit down in the morning over your first cup of coffee or tea, it has a very sweet and special place in your mind? And that's how I remember the first 4 hours of my son's existence. He was a normal child in newborn nursery, and I laid in the recovery room because that was back in the good old days when we didn't have LDRs, we had recovery rooms. And I remember saying to myself, I am a mother, and you sort of roll the word over, I have a son. And I knew that all my A's was going to follow my B's and my C's would come later. Except that at the age of 4 hours, he had a full cardiopulmonary arrest in the newborn nursery, effectively ruining the nursery nurse's day, I've been told. My husband at the time was out having breakfast with my mother at the local Burger King, choosing his name. They came back. at about 10:30, about half an hour after he had had his episode, and my husband walked up and he says, Bradley is right here, and he wasn't right there. And he knocked on the window and he knocked on the door and he said, what happened to my son? Where is he? You probably moved him. He's probably with his mother. And he said some of the most frightening words he's ever heard is when the nurse took him by the hand and said, "We are so very sorry, Mr. Bush. He is next door in the neonatal unit." Whatever that was, we didn't know. We'd never heard of one before. He came down to my room. I had already heard that he was in the neonatal unit, but again, I had no concept of what this would mean to us. We got our act together, got in my wheelchair, and we rolled down to the unit. There is nothing that can prepare a parent for entering the neonatal unit for the first time, even though we try. Even though I try very hard now as I have the parent outside and say, this is what you'll see. These are the machines you're going to find. This is what your baby may look like. My first impressions was that of a large amount of noise. I'd been in hospitals before, and nowhere had I heard anything as noisy as all the alarms ringing off in the neonatal unit. And I knew that every time an alarm went off, a baby was dying. I knew that. It had to be. We walked into the unit, and by other cribs, as other babies were lying, I'd never seen a 600-gram baby before. I'd never even seen a 600-gram doll before. I didn't know that such things so small could live. We walked over to the crib, to the radiant warmer where my son was lying. He was on a vent. Later I found out, the UAC, the UVC, the peripheral lines, and all the gadgets that we attach. And somehow it made him shrink under that. I couldn't see him. All I could see were these machines, and it scared me to death. And to this day, I will remember our primary nurse. I probably wouldn't recognize her on the street if I saw her, but her name was Sandy, and she made a profound impact on our lives. And she walked up and she put her arm around me and she said, "You have a beautiful son." And at that moment, I looked down and I said, yes, I do. I do. Underneath all that equipment, all those wires, that was still my son. I'd like to tell you today, as if you don't already know, that each and every one of you in your relationship with a mom and a dad, you will make a difference in the future of that neonatal family. You will make a difference in how their memories, whether positive or negative, affect the rest of their life. That's a lot of pressure. You already know that, but I want to make sure that you know that we as parents recognize and appreciate that fact. Partnership is sort of a nebulous type of word. There's a lot of different ways you can have partners. You can have your husband, your partner for life. You can have your golf partner. You can have your business partner. So, like any good student of the world, I grabbed out my dictionary and my thesaurus and my encyclopedia and anything else I could find, and I looked up partner. And the first definition that I came to was that a partner is one of several owners of one thing. In the medical profession, I think there are a lot of levels of partnership, a lot of levels of ownership. If you go into an adult unit, this is very clearly defined. If I admit myself into a hospital, I am a definite individual with my own ideas. I am a consumer of this physician, and I will take an active part in determining the medical care that I can and will receive. When we start lowering the age of the patient into pediatrics and then into neonatal, suddenly this concept of ownership becomes more blurred. The parent is the owner of the child as long as their decisions are appropriate in the situation. How many times have you ever heard of an adult being taken to court to be forced to receive blood for his or her own benefit? It's a very defined role for an adult. It is not for a child, and particularly for a neonate. And nowhere but in the neonatal unit is the parent as unsure about their own role as the parent of this child. A mother mother wrote the following about the ownership of a child. She says, "Don't you see this child is mine? No, he is not a product of that loud, laboring incubator. I birthed him, you mother him. Surely his birth certificate is not your title of ownership, for it is I who made the ultimate sacrifice, the grand investment of body and soul. I who have all the rights, yet I feel like the intruder in the private love affair of you and my child. I become clumsy and inept whenever I'm near him, while your practiced, perfect presence maternally guards him from harm and guards him from me. Surely you can love him a little less for my sake." Remember, if you will, the last neonatal admission you had and the first time the family came into the unit. Now, normally this is the dad. Mom's still back in recovery or recovering from a C-section or whatever. A lot of times, the first time I see Dad, he's like peering through the window. You know, you get the eyes through the window or through the doorway because he's afraid to come in. This is your territory. This is the nurse's territory, the medical territory, and there's no more territorial object than the human male. So you send the secretary or your aide or somebody over to, forcefully drag him through the door and reassure him it's okay, you can come in, and he walks toward you. Does he walk right up to the radiant warmer? No, 3 foot away. He's over there, and he's standing very rigid. He's probably either fiddling with the cords on his cover gown, or he's jammed his hands in his pocket and fumbles with his keys, so the scrub is now no good anymore. You look into his eyes, and what do you see? Is it the pride and the love and the joy of a father who now has a son or a daughter? It's terror. It's alarm. It is incredible uncertainty. What am I doing here? What is this baby doing here? Is this baby really mine? Oh my God. Now imagine that you and this father are now the partner in a business venture, and he is the person that walks into your office the first day. What is the first thing you think? You think, we are in trouble here. Our business is, unless I take some control of this situation. I have here a partner who has an ownership, who has a valid claim in this relationship, and he doesn't know what to do with it. So perhaps you say to yourself, it is time that I take my knowledge and my expertise and my comfort with this situation and help to guide this partner of mine into a valid relationship, one where we will have some productive results. Another mom wrote an interesting observation on neonatal nurses, which I found to be somewhat complimentary and maybe a little insulting at the same time, perhaps because I recognized myself. She said, "Over the weeks I met dozens of young women. Each day, Michael seemed to have 3 new nurses. Some were chatty and some were impassive. Some were aloof, though some were so maternal and sympathetic that they brought tears to my eyes. Far more striking than their differences, however, was what they had in common. Like air traffic controllers in an atmosphere of imminent crisis, they had to make minute-to-minute decisions. The NICU nurses work more independently of doctors than nurses in any other area of medicine. They are far more important in the lives of their tiny charges than are the baby's own parents. And I think the nurses know this and like it." Any competent businessman entering into a relationship knows that the first thing you need to do, as my husband tells me, is know the players. You need to know who's sitting down at the table with you. You need to know who's involved in the relationship. We often refer to parents, professionals, plural, parents, plural. And I'd like to put out today that we recognize the fact that there are at least 2 partners in this relationship, the healthcare professional and the mother, quite often the father, sometimes not, but the parents are 2 separate and distinct individuals in the way that you deal with them and the way that they deal with each other. So we're talking of a partnership of at least 2. When my son was 36 hours old, the doctor called us into the unit, my husband and I, and he said, "I'm sorry, things are not looking good." He talked about things such as pH of 7, blood gases were running in the 15 range. He had persistent fetal circulation. In my naiveness, I thought that if a baby didn't breathe, you put him on the vent breathed for him. Very easy. You blow up his lungs, they close, they breathe, they have to live. I didn't understand all the things he was telling me, but I did understand one thing. He says, "We are running out of options." It was the days before jet ventilation. There were no ECMO beds available in the state of Florida. "We are running out of options. Please call your pastor because we think he's going to die." And I vaguely remember, murmuring, "Thank you for telling us," and all those sort of trite things parents dig up to say, and the doctor, looking uncomfortable, says, "I'm so sorry," and the doctor left. And my husband said, "I'm going to step out for a minute." And he did. Not out of the room, but out of the hospital. And he got in his car and he left, leaving me by the bedside with a preconceived notion of how we would handle this crisis. We were going to stand next to each other with our arms around each other, and we were going to be with our son until he died, together, the three of us. And instead, as a very new mom, in my hospital gown, I stood by the radiant warmer by myself. I had no idea where my husband was. Sounds strange. Does it make you angry? It made me angry. It made me very angry and very uncomfortable. How dare he not act like he is supposed to during this crisis? He is supposed to do what I think he should supposed to do right there with me. This is the right way to do it. It's the only way I considered. And now as a nurse and dealing with situations where mom is not acting appropriately, dad is not acting appropriately, or to what I consider they should, I try and remember back, and it's only been a few years ago that my husband and I have talked about it. As you can imagine, it's rather a touchy subject and one that we feel very deeply about. So a few years ago in discussing the Neo, I said, "Ken, where did you go? Why did you leave me there? How could you leave your son who you thought was going to die?" And his answer was, all I knew was, I couldn't be there when he died. I could be there every second of every day for as long as it takes while I still had hope. But when they told me he was dying, I could not watch my son take his last breath. So I got in the car and I drove around Tampa until I ran out of gas. And I pulled into a gas station and put more gas in, and I kept driving because I knew if I drove till dawn, then he would be gone and at peace, and I could come back and I could deal with that. And in that moment, I realized that while I was considering how I felt while my son was dying, my husband's son was also dying, and he had an entire different situation. In your dealings with parents, one of the most important things that you can share with them in forming a good and solid partnership, a good relationship, is to help them understand that they're not men who act one way and women who act another way, that they are separate and distinct individuals, and they're going to react to this crisis differently, and often not meeting up to each other's expectations or your own expectations at all. At no other time is grief so equally shared as when a child or a neonate is in danger. If my father-in-law, heaven forbid, were to die tomorrow, I would feel immensely sad. But the fact is, it's my husband's father, and my first thought would be to comfort him while grieving for my father-in-law. When a child is dying or in grave danger or admitted to a neonatal unit when the uncertainty is so much in the forefront, How does a mom and dad comfort each other when they don't even know how to react to their own grief? Another definition, as I looked in the book, was that a partner is someone who shares with each other. And I would like to share with you a few things this morning that we as professional people can share with our parents and help to make our relationship a little better and perhaps the Neo course a little easier. And a few things as a parent that I have gathered over the past few years. First thing we may be able to do is start the parents on their recognition process, recognizing what you may say. First off, the parents are going to be feeling a lot of different and individual emotions, and they're okay. You know, through the years we've been taught how we should react at the birth of a baby, and anger and grief and terror and uncertainty are not part of the emotions that we've been raised to have at the birth of a child. To help the parents recognize that what they're feeling is okay and normal in almost every situation, except, as we know, those where the parent may feel suicidal or exhibit a violent tendency. I often wonder what it means to grieve appropriately. I've thought about that a lot. And I've watched a lot of parents in the grief process, and I see it written a lot. Mom grieving appropriately, dad is not accepting this and such, or grandmother out of control, parents grieving appropriately, or any of the combinations of that above. As a student nurse, I was up on pediatrics, and I remember at a post-conference, one of the other student nurses came in. She'd been in pediatric ICU that day, and we had a little 2-year-old drowned victim. He had had 2 flat EEGs, and in the state of Florida, 3 requires the turning off of life support. And Dad was in the room, and the student nurse was in the room right after the second EEG was done. And she said, you know, right after they rolled that equipment out of the room, Dad looked down, and he saw a spot on the bed. Now, I think it was betadine, but he said it was blood, and he came unglued. He ranted, and he raved, and he talked about the nursing care. And she said in post-conference, I thought rather self-righteously, she says, my child was in the hospital overnight for gastroenteritis, so I know how it feels. She says, I think this father probably needs psychiatric help. He's not grieving appropriately. I find it hard to imagine what it would be like to be facing a 3rd flat EEG on my child. And this child, as a matter of fact, woke up 2 days later and is now normal, the only one I've ever seen. A friend of mine had a child at 27 weeks gestation at a large teaching hospital in Florida about 10 years ago. She had had a C-section. She woke up, she thinks, somewhere in the vicinity of 3 to 4 hours later, and her infant had already died in the Neo unit. Her husband had been there. She said she woke up and somehow knew there was this incredible sense of loss within her. She knew somehow that the infant had died. And she says she started crying and ranting and raving and just totally out of control. She says, I was sobbed in my bed. She was recovering in the same recovering room as other moms who had had C-sections whose children were in the nursery. And the nurse, in a panic, ran up to her and grabbed her by the shoulders and said, if you don't stop that carrying on right now, your husband will never let you have another child. My friend shared this at a grief conference a month ago. It's the first time she has ever been able to relate it in public. And after she shared that, even though she had half an hour of more material, she couldn't go into it. It was that deep a reaction in her for one sentence from a nurse that perhaps just wasn't thinking that day. You can and will make a permanent, lifelong difference in the life of a Neo family. You you can help the parent recognize the ownership of the child. And we talked about that a little earlier. The first day that the parent walks in, it's going to be a very unequal relationship. We don't have a lot of choice in that as professional people. But as time goes on, you can do everything you can as a professional to help the parent recognize that they are the owner of this child, that they have a vested interest, and that they are competent and will be able to take care of this child in the future. Help them recognize their potential as parents. And we've probably heard it before, but I'd like to say it again. A few tips to do that. Help them out with some of the simple tasks. Remember some of the parents you've had the first time they've diapered their babies? They may have 4 children at home, but it is not the same as putting a diaper on a 3-pound baby. And their hands shake and they fumble. And I've seen more dads than I can count put them on backwards, and moms too. And you say, no problem. You're going to get it. I know it's a little uncomfortable. This is a hectic situation. We're watching you. Every parent knows they're being watched, whether they are or not. We know that somewhere someone's writing a note about what we're doing. So encourage them and say, yeah, you're doing it right. You're taking responsibility of the baby. You are going to do great at home, no problem. Provide the parent with as much information as you can. In one of the handouts that I believe is in your packet, I put in a list of books that I don't think anyone should be without. And at the bottom of that list is one called Handle with Care, Articles about the High-Risk Neonate. It is a series of articles, very short and very to the point, that authors have put together. They're reproducible and you can hand them out at will, and they are wonderful. Is this child just starting NG feeds? Copy something down. Write it down. Draw a little stick picture if you have to and give it to the parents and say, this is how we are doing this. You know, the tube starts here, it goes to here. This is why we're starting out with half-strength formula. This is why we're starting out with 1 cc and we're going to increase it. Or is this child going home with an apnea monitor? Is the child in an oxy hood? Get information and give it to the parents. For one thing, you will be saving yourself a world of grief as they come in and ask the same questions over and over and over. Give them something they can take home with them, sit down in the quiet of their own home where they are not being watched, where they can look up the words in the article, where they can write questions down on the back of the paper. An informed parent is one who can regain control of their child's life. Never be afraid of giving the parent more information than you think they can handle, because the important thing is you are there. I'm giving you this piece of paper. Read it, and if you have any questions, come back to me tomorrow, and I will be happy to answer them for you. I'd like, if you could, to give the parents, share with them a little bit of the glimpse of the future, the realistic future that this child may have. The day before discharge, we went through our discharge planning list. I'm sure everyone has them, you know, can they diaper, can they feed, down the line. And at the bottom, we had a section on special instructions and care. So here I have in my arms this child that looks like he's been through 2 world wars, sort of like a big kid, but not very, very pretty in retrospect. He'd been multiply coded, on a vent, on more drips than I can count, kidney failure from indomethacin, which back then was experimental. And as I got down to the list, I thought, special instructions. I'm going to learn how to take care of this child. And the only thing that had been written there, very well-meaning by our nurse, was, do not immerse penis in water. And I said, I can do this. I can do this. I can do this. This is great. Obviously, recently circumcised. When an adult has a heart attack and they're on the cardiology floor, and they go through all the medical technologies that get them back to the state of wellness and they're about ready to go home, the nurse on the cardiology floor rarely comes in and says, you are cured. go out of here and just go for it. Have a good life. What she normally says is, you're going to be okay. We think life is going to be good for you, but things may be a little different than they were before. There may be some things in your life that you need to watch out for. You know, the exercise, the diet. And the patient says, great, no problem. If I'm prepared, I can handle it. When it comes to an infant, we want all infants to be discharged perfect. I do. I go to a delivery and I work really hard to get this kid out of that DR and through the unit, and I want very badly to say to that parent, and I have also often heard it said, take the baby home and treat them like a newborn because they're fine now. A discharged baby from the neonatal unit is not normal, is never normal, and that's okay. It's okay that they had a different beginning. Therefore, their future may have a few different turns as they get older. No matter how dry I kept this kid's penis, it did not keep him from being readmitted 3 weeks later for respiratory infections and multiple times through the first few years because somewhere down the line no one had mentioned that his lungs were shot. And I found that out. But it would have been so much less devastating on that first readmission had someone mentioned to me, you know, being on a vent at such high pressures and this and that, he says, he may be prone to respiratory infections, so don't be surprised if this happens. We all know that things may not work out perfectly. And I'd like to read to you a short excerpt of a conversation that a parent overheard and that I have heard many times in the neonatal unit. She said she slipped in to a side alcove to pump some breast milk. It took me a moment to realize that 2 nurses were airing their feelings about premature babies. One nurse, who was blonde and delicate, groomed meticulously, was saying that if she were ever pregnant and went into labor early, very early, she would simply stay home. She didn't spell it out, but her implication was clear. She would choose almost certain death for her baby rather than bring it to the hospital. I never asked that one nurse in the NICU why she would let her hypothetical premature baby die, but I can assume she had to be thinking of all the things that can and do sometimes go wrong. We all know sometimes that things can happen, and I would like to put out a few pointers and flags that maybe you can share with parents in your relationship as a child gets older and is about to be discharged. In our unit, we call them the flags, and we go through and look at them. For example, ototoxic drugs, high bilirubin levels, an IVH. All may be flags for a potential hearing deficit. Most hospitals test their babies before they're discharged, and the results may be normal. However, studies have shown that they really need to be tested at least 2 years down the line to have a reliable baseline done. So would there be a problem in discharging if you said, you know, because of this and that, even though your child has passed the hearing test, we really suggest you get it again in a couple of years because we just want to make sure. Do you have a child who is near term that was multiply intubated? Did you know that multiply intubated term or near term children also have gross feeding difficulties? They spit up and they gag and they turn blue and all sorts of disgusting things that scare parents to death. So to say to a parent, you know, you had a big baby and we had to put the tube down several times. If he starts to choke a little and things as he gets older, be patient and work with him. And if you have any real questions, give us a call. He may do great, but, you know, sort of keep an eye on it. And then there's the big question. What about his mind? What about school, right? Major. I'd like to share with you a few things that came across my desk a couple of months ago. Do you know it's very hard to get good, reliable things about neonatal children in school. For one reason is the really sick kids, the really low birth weight kids, the PFCers, they're just now the survivors reaching school age. It's hard to know what to tell parents, but I want to share something with you. It's from Dr. Marjorie Getz, and she's the clinical liaison for education at Chicago, Illinois. And she wrote an article for a newsletter, and I want to share 4 quick points. So when the parents talk to you in this relationship, maybe you'll be able to point them in the right direction. The first thing she says is something we really all know. She says intracranial insults which result in damage to the brain result in long-term neurological sequelae. That's pretty much cut and dried. However, I'd like to go on, and she cites a study in which of every 100 neonatal graduates, 8 would be in classrooms for the learning disabled. 4 would be in classrooms that serve the developmentally delayed, and 4 would be in classrooms for the grossly mentally retarded. 16 out of 100 neonatal babies, which is almost 4 times as many children as if you took 100 randomly selected school children from any of your local schools. She also said that one study looked at very low birth weight children at 9 years of age, and the findings suggest that even though the children may have normal intelligence, they were free of neurological impairment. They often did not perform quite as well as their counterparts who were full-term, healthy infants. And usually, these difficulties were not explained by an IQ level. We've always thought that as they got older, there may be some difficulties, and they're just now picking up that yes, there might be. So as the parents ask you, you're like, oh boy, do I get to be the prophet of doom today? He says, yes, your kid's going to go to school and, we're talking no doctors here, boy. We're talking, educable. What we need to explain to parents is to be honest with them and say, your child had a difficult beginning, a different beginning, been through a lot, and they're a survivor. But what we need to do is be aware of the possibilities. Yes, your child may have the possibility of some difficulties when they get to school, but encourage the parent. Let them know that as a parent, their instincts mean a lot. You can say, be open to testing as your kid gets older and rely on your gut feeling. If you think there's something wrong, run them down to the school board, run them down to your follow-up clinic or whatever you have available. Be aware of the possibilities. And if something then does result, it is so much less devastating in the long run. The last thing that I'd like you to consider as you're dealing with the parents, to share with them, is be a lifeline to the real world. A neonatal parent is 99 9/10% in that neonatal unit. Jobs, finances, family, down the tube. Their world is focused on that infant in that isolate. And they may be grasping onto the world outside with just the tiniest little bit of a toehold. It is hard to consider saving the child when you lose the family, when their world crumbles around them. A recent study by a psychologist in Milwaukee suggests that greater than 70% of neo families divorce within the first 5 years of the neo unit. Sort of depressing. Have you ever considered the financial situation of this parent you're working with in the unit? We can talk about a lot of very personal things with our families. We can talk about, their deep and innermost feelings, but money is a hard subject to broach. And I think for a long time we thought that is a very tasteless, tacky thing to talk about when a child may or may not be on the verge of death. However, many parents wait until the last minute of a pregnancy to put their child onto a family insurance plan. They may only have 24 hours to put a child on their insurance. And as hard as it may seem to, when you first meet the parents, to just, when you leave here, have you stopped by the business office? I just want to make sure for your own peace of mind that everything is straight for you. A couple of years ago, I spoke to a group of Rotarians. They were all male. It was the first time I'd ever spoken to an all-male group, 40 businessmen on parenting the high-risk child. I said, oh, this ought to be good. So these are people that don't know the Neo unit. So, you go in and you're trying to create a visual picture for them. This is what it's like, this is what it feels like, and they just, sat there. And, I thought, this is going good, boy. And as usual, I took Brad's bill. That bill wasn't very bad. It was 9 years ago. It was $40-some thousand. And as you know, that's pennies. But the bill looks great because it's about this thick, and it's on computer paper. And when I got to this part, I said, and this is his bill, and you push it off the edge of the podium, and it goes ding, 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 onto the floor, and these men's faces dropped. I got their attention, and they stared at this bill, and one of them, questions, and he said, how much is that? And I said, it's, like $42,000. Someone else says, you had insurance. Yes, I had insurance. Blue Cross Blue Shield pays 80%, leaving me only with a bill of $8,000+ at the age of 24. My friend who had a child at the same time had a $450,000 bill. They declared bankruptcy. What choice do you have when you have an $80,000+ deficit? You could pay cash for, in Florida, a house. I don't know about here. When the parents realize this down the line, it can be devastating. And as we all know in our own personal relationships, money problems are a big contributor in a lot of marital difficulties. So when you're trying to connect the parent with the real world, keep in the back of your mind the finances, the subject that we don't talk a lot about. Consider who else you can pull into our partnership. Would a financial counselor be good? Do they have a church group or a minister who would be particularly supportive? Is there extended family? Who in the outside world can we draw into our relationship to help make this an easier time for the parents? That brings me to the subject of parent support groups, a subject near and dear to my heart. Parent support group people, at least the ones that I've known, they have a saying, and they say the parents live in the Neo unit and they have a toehold on reality. We as support group people live in the real world, but our heart is with the parent in the Neo unit. And also in the syllabus, I have listed several support groups. One of them here in Atlanta, who I spoke with before I came up, that I understand works at some of the local hospitals. Support groups are good for several reasons. First off, they are an accepting, non-judgmental part of the real world that you may not get anywhere else. It is really tough to take your baby's first pictures to work and expect anyone to say, "Isn't he cute?" All they can see is the wires. You can take them to a parent support group meeting. They've seen the wires. They've seen the tubes. They look at it and they say, I think he has your eyes. I think he has your ears. How is he doing? He looks pretty good for 600 grams. He's a pretty good-looking boy. They're non-judgmental. There's not anything that you can say there that will shock or that will get that sort of horrified look on their face. And best yet, they'll continue to let you talk and to share with them. What can I share as a parent with people as professionals? First off, I'd like to let you know that if I was that 24-year-old mom again looking in the nursery, and they had given me my choice of all the infants there, I would never have chosen my son. And you know that the school counselors just go bananas when you say that. They go writing furiously. And I said that to one about a year or two ago about Brad, and I said, you have to understand, this was not my first choice. And she says, really? And I said, well, let me put a situation to you. I says, you're 24 years old, or 34, or 44. And someone walks up to you and says, well, got a baby for you. Now we're going to have a few problems. You know, he's going to be on a vent. He's going to be in this failure and that failure. We're going to shave his head so he looks all weird, and he's going to be skinny, and he's going to eat bad and throw up a lot. Probably going to go home on a monitor, and you're not going to get a good night's sleep for heaven knows how long. No one's going to want to babysit for you. You aren't going to want anyone to babysit for you. So you're going to stare at this child for the next 2 years, your husband and you, every evening in your home. And then just when you think you're out of it, we're going to throw in hernia surgery. We're going to throw in a pair of glasses when they're 3, maybe a hearing aid or 2, just so they look strange to all the children in their class. So now when they start first grade, you have to deal with that. It says, and in your case, we're going to give him like a really bad case of asthma. Put him on 20 meds a day just to keep life interesting. So that's your first choice. Your second choice is you can have this cute little boy over here. Your husband's going to get your roses and you're going to go home. So what sort of choice is that? And she said, oh, and wrote some more. I don't know what she wrote. In order to accept the situation that you end up with, in order to be truly happy with what you have to accept that you lost something. I had to accept the fact that I lost the baby that I wanted. I lost the experience that I expected to have. I'm probably dating myself heavily here, but I remember watching My Three Sons. I could say they're on Nickelodeon reruns, and I watched them there. The oldest son, as I recall, married this ditzy blonde person, and they had triplets. Big monster triplets. Nobody ever in this show that I recall mentioned like preeclampsia or toxemia. I don't recall her being on bed rest. So she comes home with these monster, 12-pound triplets. And there's roses everywhere, and there's cards, and everyone's happy. And I watch TV. I know what I deserve and expect, and I thought that's what I was going to get. It's hard to accept when your dream is lost. But it's necessary to acknowledge it in order to take the reality that you're given and see the wonderful prospects that it has for you. I'm not sure that I really understood that until a few years after my second child was born. I went into nursing school, and I was at a sort of an elite hospital in a expensive section of town where there's lots of gadgets and things, and I was in the nursery bathing a newborn baby, and I looked up at the wall of windows, and there was about 1 million family members. There was mom and dad and 3 or 4 sets of grandparents and 100 or 2 aunts and uncles and their fraternity brothers, and they all had video cameras. And there were balloons, and there were flowers, and there were banners, and they looked so happy. And while I was happy for them, I felt so immensely sad for me, for my husband, for my parents, for my father, who to this day, at 9 years, never loses a chance to say on Brad's birthday, "Pretty hard to believe that 9 years ago today, he would look like this," with tears in his eyes. It's not something you remember or think about every day, but it's something I wish he could have had, the balloons and the banners. And the innocence of happiness without the little bit of the negative side. I'd like to share with you the fact that I appreciate that I can share with you stories about my son. As I mentioned, his first baby picture doesn't look very good, and he was 7 pounds, so he looked pretty darn good compared to a lot of the kids in that unit. 2 years ago, they had a My History thing in the first grade. And the teacher said, "Let's bring in our first baby's picture." Ah, jeez. So instead of being assertive and just saying, voila, I'm going to send that sucker in, I went to the teacher afterwards and I said, I need to explain to you something. He says, you know that he was in the unit, but his first baby picture is not very good. It's got these tubes and it's got these things, and Are you ready for it? She said, bring it on. And that meant a lot to me. So I sent it in with another little book, essential reading. It's on the syllabus called No Bigger Than My Teddy Bear. If you've never seen this little paperback, it is a wonderful book about a little boy's story of his baby brother who is no bigger than a teddy bear in the neonatal unit. And this first grade teacher read this story and showed Brad's picture and said, and that's Brad's history. What do you think? And the kids all thought it was neat that Brad lived in a glass house. I went to a baby shower a couple of years after he was born, and they were going to play this game where you brought in your own baby picture, and you brought in your children's baby pictures, and you put them all on a board, and you guessed, right, down the way, and you got a prize for who guessed the number right. It was a church baby shower, and a very well-meaning sister walked up to me and sort of took me aside, and she said, you know, we're all going to bring our pictures in. She says, but no one expects you to bring Brad's. My mother was so angry. So needless to say, I went home and found the worst one I could find. And I brought it. It wasn't even the one in the unit. It was the one when he came home and his hair was all cut off funny and he had bumps all over his head and it was really bad. When I ask parents who are friends of mine in the support group what they wanted me to say about the future, about how they feel personally, about their feelings of the future of their child, what came up the most is they said the future of a neo child is waiting for the other shoe to drop. No one thinks that a baby can get sick. No one thinks that a child can get sick, so you don't expect it. But for those that have gone through it, the very first thing, the very first moments, they know that the one shoe's already dropped and that it's very possible it could happen again. Are we being paranoid? I think so sometimes. It's hard not to blame everything that goes wrong on the fact that your child was in the Neo unit. You know, he fell down and skinned his knee because his motor coordination really isn't what it should be because 12 and a half years ago he was in the Neo unit. Or we think we could make a fortune selling football jerseys for our 16-year-old 6-foot sons that say, please tackle lightly. I was a preemie. But the humor makes it easier when the other shoe does drop. A friend of mine was sharing with us an experience. You know, you sit around and tell grosser than gross stories about your kids do, right? And I was explaining how my youngest son was using my husband's toothbrush to stir soup in the toilet bowl. And my friend's child has a trach. We've grown up with it, and it's a part of our lifestyle. And she says, well, I want to tell you a story that I told, you know, the church ladies the other night. She says, they didn't think it was very funny. She says, I couldn't find Emily, and I went running through the house yelling, Emily, where are you at here, you know? And she ran out and signed to her mother, I'm going diving. I'm going diving, okay? This child has complete tracheal atresia. She took all her toys and she dropped them in the bottom of the toilet bowl and she stuck her head in. And left it there, breathing happily through her trach. And this friend of mine says in this wonderful Alabama accent, she says, those ladies at the church didn't think that was funny at all. A parent wrote another little thing about recognizing your child. And she says in it that it's okay to come in and be happy for me and be happy for my child, to be happy that I am a mother. But please recognize that I am a mother. Please recognize my child for all their differences, for their different beginnings, for the different future my child may have. Be happy with me. What I want to share most of all through all the downsides of the neonatal unit is that if I could go back 9 years, knowing what I know now, knowing how in many ways my life has been changed for the better, I would not have changed a second of the terror or the negative times or the tough times in the marriage. I wish with all my heart my son would not have had to have gone through it. But what it taught me, I think it was a pretty good person to start with, actually. But I think that in a lot of ways, it opened my mind to other people's problems. I'd never known a handicapped person before. And now all of a sudden, trachs and hearing aids and glasses and nebulizers are a part of our life. And as far as my sons, I think it makes their lives richer. They don't know that there's really any difference between Emily with her trach and them. And sometimes they'll run up and say, "Miss Jane, you need to do something. She's making that noise in her throat again. Get that machine out so we can keep playing." When I first, as an adult, saw that suction machine, not being a nurse, I was terrified. I watched the child waiting any minute for her to drop over dead. I'd like to share with you about my son right now, and I do have pictures, many, for later, for anyone that wants to see them at all. He's 9 years old. He turned 9 last month. My husband was out of town on business, and he phoned at 7:30 that morning and talked to Brad and wished him happy birthday. And I got back on the phone, and there was silence, and he says, 9 years ago, we had a healthy son for 3 more hours. And I said to Brad, I said, 9 years ago you were 1 year old. He says, "That's right. And I wasn't even sick yet, so I didn't have any of those neat things." I said, "That's right." We have had our difficulties. He is a severe chronic asthmatic. He doesn't last long without his medication. He just got glasses, but as you can tell, that's probably hereditary. He's been through quite a few hospitalizations. He had some emotional difficulties from the neonatal intensive care unit. But that's not what he is about. He is tall, and he is blonde-haired, and he is blue-eyed, just like my little girl was going to have been. And the little girls love him. He has a girlfriend that calls him every single day of the week. As far as school goes, we've been very lucky. We think he's at the top of his class. My husband is going solo to the parent-teacher conferences this afternoon, so we'll see how it goes. I asked him to write something about being sick as a baby. And this is what he wrote. He said, "When I was little, I could not breathe. I was in a hospital with wires. There were lots of doctors. I think I was very special." It is a part of his history, but not what he is all about. As I was finishing up my outline a couple of months ago, my mother-in-law, who I love dearly and knew I was trying to do this, she says, "I found another definition for a partner." And she pulled it out of the book, and she said, "A partner is," and I have to find it here, "a framework of timber round a hold in a ship's deck to support a mast." I said, "Say what?" And my husband says, "I knew you'd get boats in there. We're avid boaters. Knew you'd get boats in there somewhere." And I looked it up in the encyclopedia, and there's this like round wooden thing that holds up the mast in a sailboat. And I said, corny as that is, I really like that analogy. Without a mast, there is no sail. Without a sail, there is no progression. You sit in the water and you stagnate, and you never get ahead, and you never see the future that could be. So on those days that we have that are tough, when the parents have yelled at you in the unit, when the doctor has yelled at you in the unit, when your primary patient has taken a turn for the worse, please remember that what you do influences and changes the life of an NICU family forever, hopefully for the positive. You will affect the memories of those child's first few days, and it's such an important time in their life. I'd like to share with you a very short video. It's called Jesse's Song.
Jesse waited hands for weeks and weeks. She went up and down, the lungs too young, but her heart so strong, watching her struggle, wondering for how long, meeting her dad, seeing his despair, silently watching, is Jesse lying there, keeping his fears deep in a trembling heart, hoping to soon Jesse's real life would start, and I believe in what we're doing. I need to see the triumphs as they come. I believe in what we're doing. I hope you share the good things that we have done. And I've been there when babies died, shed the tears of those who tried and didn't win. And victory is oh so sweet when I had the chance to meet a brand new friend. 110 days, and Jessie went home in her mom's arms, not quite so long. The skills of her keepers gave her a chance to live. I'm glad there was something that I had to give, and I believe in what we're doing. I need to see the triumphs as they come. I believe in what we're doing. I hope you share the good things that we have done. So when all you see are people with their hands stretched out, when you wonder what this crazy job's about, just close your eyes. Remember Jesse that you know, growing strong, 'cause of what we've done, you believe in what we're doing. And you'll see the triumphs as they come. You believe in what we're doing, and you'll share the good things that we have done.
Thank you for your time this morning.